Welcome to the University of Alabama at Birmingham's Department of Human Studies. My name is Eric Plaisance. I'm an assistant professor in the exercise science program here. And what I'll be doing today is talking to you about what you can do with your degree in our kinesiology program here at UAB. And one of the things that we're going to do is break this talk up into really two different sections. The first part will be clinical applications, looking at things that you can do with your degree from a clinical perspective. The other thing that we'll be doing is talking about the non-clinical applications of the degree and what you'll be able to do with your degree from a non-clinical perspective if you go that route. So first and foremost, when I think of classical exercise physiology and what you can do with your degree, one of the foremost things that comes up is exercise physiology in clinical settings such as cardiac rehabilitation or pulmonary rehabilitation. So cardiac rehabilitation is a program for patients who have either undergone medical treatment for or surgical treatment for heart disease, for stroke, and other related cardiovascular disease complications. Typically, working in a program of this nature requires at a minimum an undergraduate degree in exercise science or a related field. Typically, certifications from the American College of Sports Medicine are required for you to work in this setting as well in either cardiac or pulmonary rehab. And as well, there are additional requirements, usually with advanced cardiac life support and things of that nature. Pulmonary rehabilitation is a very similar field, often done in the same hospital environment, and it includes patients who have some form of pulmonary disease, from asthma to chronic obstructive pulmonary disease like emphysema or chronic bronchitis. These similar certifications from the American College of Sports Medicine are also required as well to work in this particular setting. And in both programs, the design is basically for individuals with degrees in this area in exercise science to work to design exercise programs, to help to provide healthy diets for individuals who are working out in this setting as well, to basically improve quality of life and functional capacity within these individuals. Another really classical area that we see a lot of our students going into is the field of diabetes education. And in diabetes education, the idea is to take individuals who are newly diagnosed with either type 1 or type 2 diabetes and to work with them to help control their blood glucose. In this country, there are over 30 million people who have either type 1 or type 2 diabetes. And the role of the exercise physiologist in this setting is to help provide safe and effective exercise programming for those individuals to lead a very healthy life that we know exercise can really impact. You typically have to have a clinical exercise specialist certification to work in this field from the American College of Sports Medicine, or to take the certification to work with these individuals. Or you can be a physical therapist, occupational therapist, or a physician to really sit for this certification to allow you to work in this area. But this is also a very important field where we see a lot of our students going into. In addition, we also have individuals who work as exercise specialists. We have a number of individuals and currently have students here at UAB that work at UAB Hospital that perform exercise testing in the hospital setting, where they'll conduct exercise or bicycle tests to determine cardiorespiratory fitness or your fitness level in patients who may be at risk for either heart disease or pulmonary disease. Some of our students have gone on to become electrophysiologists, meaning that they work with patients who have cardiac disease related problems. And the idea is to work with a cardiologist to help them map some of the physiological or electrophysiological problems that these patients may be dealing with to help better their lives as well. And then finally, with regards to exercise specialists, working as a clinical researcher is a very exciting field. We've had numerous students who have gone on to work on clinical trials where exercise is a big part of those studies. And the idea is that not only do they provide the adequate exercise programming that's needed for those trials to be successful, but it's also necessary for them to help to analyze data, to help write up those reports, to help with grant writing and manuscript writing. It's a very exciting field if you were to be interested in a research setting. Now, I also think that our program is also a gateway to many clinical degrees. And some of those degrees include physical therapy, going on to professional schools like occupational therapy as well. In these two settings, primarily students are working with folks who have orthopedic conditions. In occupational therapy, we'll see a lot of times individuals that are relearning how to do many of the activities that we take for granted so often, that people who become occupational therapists help people learn how to do simple, routine, daily activities that oftentimes can be lost following certain conditions like limb amputations and so forth. We have a lot of students that apply and get into chiropractic school, become athletic trainers as well. We see a lot of our students going on to master's degrees in this setting. There are a number of programs throughout the state that offer athletic training and throughout the country from a master's level perspective. We have a number of students as well that go on to medical school, either MD or DO routes. Many become physicians, assistants, or PAs. We have many students that will go on to nursing school, become certified registered nurse anesthetist, nurse practitioners, as well as many others that become dietitians. This seems to be a very common route, as a number of students that get their degree, their undergraduate degree as an exercise science major, often find dietetics to be a very inviting area because, as most people know, diet and exercise go really hand in hand, and one without the other will not provide nearly the benefit as done combined. Now, what I'd like to do now is move on to some of the non-clinical applications that are related to our degree program. And these are also very exciting areas as well. While we see a lot of our student populations going on to physical therapy, in fact, about 80% of our students come in wanting to be physical therapists during their freshman year. We do find that there are a number of students along the way that seek other routes, as I shared with you from a clinical side. From a non-clinical application, I'm very excited to talk about some of the things that you can do with your degree as well, because in settings that you may work as an exercise physiologist, what we often find is that students go on to work in corporate wellness facilities. Well, what is a corporate wellness facility? Well, it's a program where several institutions, major corporations, have programs where their goal is to basically keep their staff, their employees, healthy and well. And while these are very good things that they're doing for people, at the end of the day, it makes perfect sense from a bottom line to keep their employees healthy and working hard and keeping them from being sick, because it costs them production time and things of that nature. And so many corporations around the country will hire exercise physiology trained students to basically run their corporate facilities to help keep their participants and, of course, their employees very healthy. And the job of these individuals is to provide a very extensive program of exercise, dietary advice, and things of that nature to their folks. We also find a lot of students going and working in gym settings, a number of gym operators, for example, serving as managers. We find a lot of our students going on to open up their own gym facilities, various types of gyms. These seem to be expanding more and more. Traditionally, we found a lot of students working in your typical, Gold's Gym, powerhouse gym environments. Now we're finding that many students are opening up boxes for CrossFit and many other types of facilities and things of that nature. We also see, with the growing craze in group exercise instruction, that individuals are going on to work in settings where they provide explicit group exercise instruction. usually at a gym environment, not always, but oftentimes in a gym environment. Many of our students go on to be personal trainers as well. They'll typically work in personal training. These are usually hourly paid jobs where students will be paid hourly to work with a client to help achieve whatever their goals may be. And of course, that's defined by the exercise physiologist, personal trainer, with the client that they're working with, and allows the student to use many of the things that they will learn using their degree, like learning and using measurements like blood pressures and body composition measurements to look at body fat changes over time. This can be a very rewarding job and also very financially rewarding as well in many cases for students that go this route. We find a great number of our students that would like to go on to be strength and conditioning coaches, usually at the high school level. It can be at the college level as well. And these are all areas that we do find significantly, again, that students are working in again, the high school level, the college level, professional level. Many of our students that are trained in this area often get a certification from the National Strength and Conditioning Association called the Certified Strength and Conditioning Specialist, or Cscs. And this particular certification allows them to work in an environment with a sports team. It can be any type of sport where strength and conditioning, of course, is required, which is most of our sports. But universities and professional sports in particular will often hire these individuals to help increase the performance of their athletes. And it's a great job. An area that we typically see, again, a lot of our students going into, since a lot of our students do have sports related backgrounds. Another exciting area is in sports nutrition. We do have a number of individuals that enjoy really important careers in the area of sports nutrition. Many times colleges and professional sports teams will hire nutritionists because the goal, of course, is not in addition to exercise, these athletes need to have prescribed nutrition or diets that can help them to maximize their performance. And so you'll typically see each team having at least one or two sports related nutritionists who can help them to dial in, for example, the correct food regimens at the correct time. You can imagine for those individuals that have run marathons or distance events that the timing of certain meals and the types of meals that are consumed play a huge role in the performance of that individual. It's not just about training. Individuals do so much better when there is proper nutrition on board as they continue with any type of event. Another area that I think is very exciting is in the area of biomechanics. We have had a few of our students that have gone on to work in internships as well as through other environments with jobs in the area of biomechanics. A particularly exciting area would be to work for an equipment manufacturing company as a biomechanist, which would incorporate training in exercise physiology, kinesiology, and biomechanics, and basically using engineering as well to create the ideal instrumentation and equipment to help individuals perform at their best or to help train at their best. A good example of this would be to work for an equipment manufacturer making equipment that would be ideal for athletes or for the everyday individual that goes in to work out, again, to not only maximize their performance, but also in many cases to mimic what we see being done with free weights as much as possible, since we know that free weights typically are the most ideal way for individuals to train. One of the areas that I find is often overlooked with regards to individuals performing this type of or getting a degree in this area is as a teacher. School teachers typically, what we see is a lot of our students going on to careers in teaching biology at the high school level. We'll see our students as well teaching physical education types of courses as well in this area. So a lot of our students will go on and seek an additional year of training to obtain a certification degree as part of their teacher education, and oftentimes get jobs working in a number of county settings or private school settings at the high school or middle school level. And again, we've had a number of students that have done this. As I've mentioned before, on the clinical side, researching is also another hot area that we see on the non-clinical side as well. There are a number of job opportunities working in corporate wellness programs, for example, where research is done to get an idea of what health and wellness is doing to impact insurance costs, to influence the cost of production and things of that nature. It's a very, very exciting field to get into. And then again, as I've mentioned before, the personal training side I think is also very, very exciting. One of the last areas that I want to talk about with regards to what you can do with your degree is in the area of medical sales and pharmaceutical sales. There have been a number of students, not only from this institution, but many other institutions that we see go on to do both medical or pharmaceutical sales. And employers are very eager to hire our students because they know so much about kinesiology, which is really the study of human movement. And because there's so much information that is obtained through our degree program, employers again want these individuals because it helps them to sell their products, whether it be in medical sales of orthopedic devices. We see a lot of students in this area with orthopedic sales. We have a number of students that go on to do pharmaceutical sales, working with numerous types of corporations in diabetes medications. They may be working with cardiovascular drugs and things of that nature. And this all makes perfect sense because in our field, one of the things that you will learn when you come into our kinesiology programs is not only how the body works, but also how drug interactions occur in our clinical type of classes, that you will learn all about how drugs interact with exercise, pharmaceutical drugs in this area, and how they interact with exercise. So I appreciate your time and listening to this video, and hope that you have a long career in our field in the area of exercise science. Thank you. All right.
All right.